Vision Senior Medicine. This is Melissa. May I help you?
Hello, Miss Salosa. How are you today?
Fine, thank you.
Turn your head a little to the side, please. So how have you both been doing? I really got into medicine out of a desire to improve humanity. And are you walking? I love to connect with my patients, not just in terms of their health, but in terms of their social life and even their spiritual standing.
She's my daughter from church.
I treat my patients as though they're my parents. That's how I get along with them. How did I do in terms of? The exciting thing for me in starting my practice was giving my practice a name. Trying to establish my own philosophy of patient care.
Have any problem with the other medications? During the first few years of doing a practice on my own, things were okay. Not great, but they were okay. In the last few years, things started becoming a little bit more difficult.
Having my own practice was not exactly what I had expected.
When you are in solo practice, you are solo, you are alone.
I'm Efra Castillo. I'm the Regional Medical Director for WellMed Medical Management. I was lucky enough to grow relatively quickly, so we grew to 3 clinics in 3 years. Some of the challenges of being a solo practitioner dealt with day-to-day function.
You have to do other things that are not medical related.
Getting all the paperwork done.
Were folks going to show up for work?
Overhead, supplies.
On weekends, I would put toilet paper in the bathrooms.
Accounting, taxes.
Was I going to make payroll?
Medicare and Medicaid.
Things that you had no control over.
When you are in the residency, they don't teach you how to manage an office.
And you can only work 23 hours in a day.
I found myself having to see more and more patients as reimbursements were cut.
And I don't think that's what anybody really sets out to do, but unfortunately that's how we end up.
It was overwhelming at some point.
And so I had to make a decision. Do I continue down this path or do I decide a different path?
The question is, why WellMed?
They offered me an opportunity where I would be employed and the clinics would be acquired.
My greatest fear when joining WellMed was that I would lose my clinic, that I would lose my autonomy.
The process was something that I had a bit of trepidation.
It wasn't that bad.
To learn the mission of WellMed, that it was to change the face of healthcare delivery for seniors by practicing preventive medicine, that really got to me.
The model really is taking care of chronic disease using standardized, evidence-based protocols, if you will, agendas, and taking the time to do the things that we all believe work.
Once you start learning what the model is about, then you start liking it.
You have a follow-up in 4 weeks, I think. Before I joined WellMed, I was seeing anywhere between 20 and 35 patients a day, just to make ends meet and to keep myself financially above the waters.
At WellMed, you have no requirement to see so many patients a day. You have a requirement to keep the patients well.
I can really do medicine. I can see my patient full-time, be dedicated full-time to that.
We were able to cover all their issues, cover all their chronic diseases, and then have support around them after the visit.
Now with WellMed, you are not alone anymore.
It's a different model, it's a different philosophy here at WellMed, which allows you to provide the best care and do well for everyone, including yourself, the patients. Everyone wins. It's a true win-win.
WellMed allowed me to continue running my own practice as though I were the ultimate owner. I was really impressed also to find out that WellMed was a rapidly growing organization with a strong financial base.
We have so much more support from other areas. I don't have to worry about credentialing. I don't have to worry about, taking care of all the little tedious day-to-day things.
I would say the impact on the staff has been tremendously positive.
We know that what we do works, and so it makes it easy, makes it great.
We'll see you next week, huh?
The question is, why WellMed, right?
All the folks that I've had that discussion with that have come on have been extremely successful. They have had opportunities, they have grown, they have been able to take weekends off and go on vacation with their family and not worry about things. So they have been extremely successful and their patients have done better.
Very happy. Now I'm very happy.